said there's nothing more powerful than an idea whose time has come. Yes, the idea of freedom, liberty, and justice for all. Yes, that was the idea, but I declare that now is the time. And if America is going to have a chance at living out the true meaning of its creed, that we hold these truths to be self-evident, that all men are created equal, then we cannot afford for this nation or its leaders to have selective ambition.
Welcome back to the Policy Lowdown. I'm your host, Kevin Slayton. Decisions about the state budget are always important, but this year they dominated the entire legislative session as our policymakers worked to address a significant budget deficit. A nearly $3 billion shortfall at the beginning of session continued to grow as the effects of federal layoffs, funding cuts began to rock this region's economy. Joining me today on the show to help recap how legislators address these challenges is my colleague Christopher Meyer, research analyst at the Maryland Center on Economic Policy, who was closely tracking the ins and the outs of the budget over the last few months. Welcome back to the show, Chris.
Thanks for having me, Kevin. It's a pleasure to be here.
Always. And we're also joined by our friend Rachel London. Rachel is the executive director of the Maryland Developmental Disabilities Council, who was at the center of one of the toughest budget fights of this year. Rachel, thank you for joining us.
Thank you for having me. It's nice to be with you today.
Before we get into the budget conversation, Rachel, can you share a bit more about the Developmental Disabilities Council and what brought you to this work?
Sure. Thanks, Kevin. The council is actually an independent unit of state government. We are 100% federally funded, and we create change to make it possible for people with developmental disabilities to live their lives with the support they need. We're actually led by people with developmental disabilities and their families, and all of our work is grounded in our vision that people with and without disabilities in Maryland live, learn, work, and play together. For the past 6 years, I've been the executive director of the council, but the truth is, this is my 17th year with the council. And I've been working with and advocating for people with developmental disabilities for my entire professional career. I sort of fell into the work after an internship after my first year of law school. And like so many others, I never left. I also just want to note that I'm also the chair of the Developmental Disabilities Coalition. You're going to hear about a little bit later. We're a group of 5 statewide organizations committed to improving the opportunities and outcomes for people with developmental disabilities.
Outstanding. And Chris, our regular listeners have heard you on this show in the past several times, but can you share a bit about your background and what you like about the work that you're doing as it relates specifically to the state budget?
Thanks, Kevin. So I've been with MedSep for 9 years now. I work on the state budget, especially tax policy. I work on public school funding, worker protections, and often a smattering of other areas. Advocating on the budget and revenue policy is exhilarating work. Everything our state government does comes down to the budget. It's how we put our shared resources to work for Maryland communities. The word budget really means healthcare, schools, roads and transit, childcare, elder care, and so much more. And raising sufficient revenue and raising revenue fairly is the cornerstone of all of it.
Outstanding. Really, it is the 90 days legislative session means nothing until the budget is settled. Chris, I'd like to start off there too. At the beginning of the budget process, what was the challenge that Governor Wes Moore and the legislature were facing, and how did the governor try to address it in his initially proposed budget?
So we entered the legislative session this year facing some really historic fiscal challenges. The state was facing a $2.5 billion projected general fund deficit for the coming budget year, which would increase to an unprecedented $6 billion deficit by 2030. And I want to be really clear. Mathematically, there is no way to address that budget gap without either making painful cuts to services Marylanders rely on or raising new revenue. The fact is there are limited policy levers available to drastically change the state's economic trajectory, especially with an actively hostile federal government like we have now. So there really is an unavoidable choice: revenue, cuts, or both. This was a long-term sustained budget issue, not just something that could be papered over for the current year. So the governor's plan relied roughly equally on new revenue and on budget cuts to fill that hole. On the revenue side, it was a pretty decent package, and it focused on those who can most afford to pay and aren't paying their fair share, which helped us avoid deeper cuts to public services. But it wasn't just good news. The governor's budget also cut the blueprint for Maryland's future, which is the 2020 plan to essentially rebuild funding for Maryland public schools based on world-class standards. Cut funding for the Developmental Disabilities Administration, which Rachel will be saying more on. Cut funding for childcare and public universities and other programs compared to the state's ongoing policies. So, it was a mixed bag with some really harmful cuts, but also some important steps forward to make our revenue system more effective and fairer.
As folks were assessing some of the cuts, it was truly the cuts to the disabilities community that caught the attention of not just the local press, but everyone who was watching this legislature. Rachel, as Chris mentioned, services for people with developmental disabilities face some of the most significant proposed cuts of any program. What was the potential impact of those cuts on Marylanders' lives, and how did the community react?
Well, look, we all anticipated a difficult session. Like Chris said, we understood the state's budget challenges, and we knew we might not get the funding increases that the community really needed to keep pace with rising costs, but we couldn't have predicted what came next. Over 18,000 Marylanders with developmental disabilities depend on services provided through the Developmental Disabilities Administration and through the Medicaid waivers. And their services really are vital for community supports that enable them to live, work, and thrive in their communities. It also allows families to continue to work and support themselves. And whether those supports for people with developmental disabilities is help at work or in the community, so you're having meaningful days when you're not working, or at home when you're trying to get things done like everyone does, cooking, cleaning, and shopping. Those are vital services and supports. So not only did it potentially impact the people currently receiving services, there are more than 3,500 people with developmental disabilities waiting for services through the DDA and the Medicaid waivers.
Wow. Legislators had a lot of concerns about particular parts of Governor Moore's budget, but it took a long time for them to come together around an updated plan. The budget didn't get final passage, as we know, until the last day of the legislative session, which is a little bit unusual. Chris, can you walk us through some of the big changes that the legislature made and what the final budget looks like?
Absolutely. The legislature rejected some portions of the governor's revenue plan, but added some pieces of their own. Let's start with income tax reform. So the adopted package gradually phases out itemized deductions for individuals with annual income over $200,000, which is a change from the governor's plan, which would have eliminated itemized deductions for all individuals. The income tax reform plan also increases the standard deduction that everyone is allowed to claim by 20% versus doubling it as the governor's plan would have done. Those two changes essentially cancel each other out to make sure that the plan still raises roughly the same amount of revenue. The plan also increases the tax rates on individuals with at least $500,000 in annual taxable income, with a top rate of 6.5% on those taking home more than $1 billion a year. The plan also improves the state's child tax credit by changing the cliff under previous law into a gradual phase-out. The revenue package that was ultimately adopted also includes some portions that will fall more heavily on working families. That includes a tax on certain data and IT services that are primarily purchased by businesses. We expect that those costs will be passed through to consumers in the form of higher prices. It also includes a number of transportation fees and excise taxes, as well as an increase to the cannabis tax. Let's move over to the funding side. So there is some good news. Most of the cuts to the Developmental Disabilities Administration, not all of the cuts, and most of the cuts to public school funding through the blueprint, as well as various transportation cuts in the governor's budget, were restored by the legislature. So we are not looking at the same severity of cuts that the governor proposed. But there are areas where the legislature left cuts in effect, such as rejecting Medicaid provider rate increases, which ensure access to care for people who get healthcare through Medicaid, rolling back certain recent improvements to our child care scholarship program. So, this budget definitely, even after certain improvements made by the legislature, has some harmful impacts on working families.
Wow. Rachel, it sounds like the final budget was a major improvement based on how it began. But are there still services that won't be available or other potential impacts on people with developmental disabilities?
So I think it would help start from the beginning. The proposed cuts were big. In fact, they were about 22% to community supports for fiscal year 26. And that doesn't include the cost containment or the cuts proposed for fiscal year 25. And I can talk about the realities of the system and the devastation these cuts would have caused, but I think all of the people that showed up to share their stories said it best. It's really, important to think about who we know with disabilities in our lives, and there are probably people who could speak about the true impact for them. The reductions really would have resulted in significant amounts of people having less opportunity and fewer direct support professionals, the people who support people with disabilities, available to provide that support, particularly in certain counties. You may have heard about the geographical differential. Their original proposal was to eliminate that completely. There were changes to people's services, the people who self-direct their services. And, in the end, we all came together and worked together to reduce the impact on people's lives. The advocacy really worked. So in the end, about over $1 billion was restored between FY26 and FY25. And that was thanks to both the legislature and the administration. And because of the work we all did together and the input that the legislature and the administration got from the community, we were able to make recommendations that would have a lesser amount of impact. For example, instead of eliminating the geographical differential for certain higher cost counties, we were able to just reduce the amount. So instead of eliminating the geographical differential, will be no more than 10% of the rest of the state. And it is things like that and coming together to have those discussions that while there are still cuts, like Chris said, the impact and the immediate impact on people has significantly decreased.
Wow. Sounds like a very good session for you all in the end, considering how it began. What did it take to get these funds back into the budget? What are some of the things you all did?
So people with disabilities, families, and advocates showed up and spoke up so many times this legislative session. These are people who know what it takes to create change. A lot of them fighting for service and supports for themselves their whole lives, and for their family members for their whole lives. But I will never forget the first rally, just the first of many things that were organized and done this session. With just a few days' notice, the Developmental Disabilities Coalition organized a Save Our Services rally. And I did the introduction of the evening. And I was standing in front of the microphone with the State House behind me and 1,000 people in front of me holding signs that said, Save Our Services. Really, the chance of Save Our DD Services could be heard across the legislative complex throughout the entire night. But it didn't end there, couldn't end there. Hundreds more people showed up for Developmental Disabilities Day at the legislature and met with their representatives. And for the These Are Our Lives Action Night, which was organized by people with developmental disabilities and attended by people with developmental disabilities. So they showed up, they talked to people, they provided testimony, educated and advocated legislatures, the administration. They really did everything that they could.
Clearly, there's no substitution for in-person advocacy. Rachel, thank you for all the work that you and your organization do. Looking ahead, Chris, are we out of the woods? And what are you going to be paying closest attention to in the coming months as we start to look ahead to the next budget year and the next legislative session?
We're not out of the woods. We are in a much stronger position now than we were in January because of the revenue package that the legislature adopted. Let's first talk about the baseline. They did not completely solve the problem. They did turn our projected $2.5 billion structural deficit for the general fund in the coming budget year into an essentially balanced budget, meaning that for the general fund, we're not relying on fund balances or one-time revenues to cover ongoing expenditures. But they only cut the problem roughly in half by the end of the 5-year budget window in 2030. So we're now looking at a $2 billion general fund deficit in fiscal year 2028, which increases to $3 billion by 2030. So there's lots of work left to do. And that math is the same. They have to either make cuts or raise new revenue. There is no third choice. That's the baseline, but there's also lots of uncertainty. We're deeply concerned about potential federal cuts to Medicaid, to food assistance, and other federal programs, both things that directly affect the state budget, as well as things like federal layoffs, research cuts, and tariffs that could trigger a recession. Any economic downturn due to federal policy changes is going to be worst in Maryland because of how central the federal government is to our state economy. So there are two possibilities for things that could happen at the state level in the coming months. First, it is possible that the Board of Public Works will make additional budget cuts. So the BPW, as it's called, consists of the governor, the state controller, and the state treasurer. And it is empowered to cut individual programs by up to 25% if necessary to cover a spending hole. That's something where there is a limited opportunity for advocacy over just a few days, but ultimately the BPW's decisions are final. Then we're also looking at the possibility of a special legislative session, which could enact further budget cuts or could pass additional tax reforms to raise more revenue, which would largely depend on whether we get more information and the severity of economic impacts from harmful federal policy changes.
And Rachel, what will you be keeping an eye on in the coming months? Is it possible that federal cuts to Medicaid or other programs could affect services for people with disabilities?
Absolutely. The truth is, any federal cuts will affect everyone, right? We are all going to feel it. And it's more important than ever that state leaders protect and promote funding and policies that support Marylanders with disabilities, their families, and the professionals who support them. Cannot overstate the impact that any changes to Medicaid will have on our state. And we all, I think, understand that Medicaid provides health care to those who qualify, millions in Maryland. But what we don't talk about enough, and what I did mention briefly earlier, is that Medicaid really means freedom for people with disabilities. It's the Medicaid waivers that pay for home and community-based services. Separate from that, we are also monitoring what is happening in our education system. The executive order to dismantle the Department of Education should really concern everyone. Based on what we understand, special education, services and supports for students with disabilities, and the oversight of the implementation of the Individuals with Disabilities Education Act is going to be handed over to HHS. But HHS just announced massive layoffs and a total reorganization. And then there was the draft HHS budget that was leaked just a couple of weeks ago, which threatens to dismantle longstanding programs that protect and support millions of people, both with disabilities and in aging. Chris mentioned some of the programs, but it is all of those sort of support programs, not the programs that provide services, but the support programs like the DD Council and like our protection and advocacy system and like some of our services and supports for older adults that are threatened in that draft budget.
Thank you both for joining me today. That's our show today. Rachel and Chris, again, great to have you. Thank you for bringing your insights and expertise. I think our listeners have learned a lot from this conversation. And so as a reminder, I want to let everyone know that you can find podcast archives and resources from this episode at mdeconomy.org/policy-lowdown. And while you're there, you can sign up for our email list or support the Policy Lowdown by making a donation to the Maryland Center on Economic Policy. You can also find the Maryland Center on Economic Policy at MD Economy on Blue Sky, Threads, and Instagram. MD Economic Policy on Facebook as well. Thank you again for joining us, and see you next time.
Those that would stand up, call our nation back toward justice and righteousness are often bashed or labeled as socialist and unpatriotic.